gravity now has become your friend, and it's going to help drain that fluid or all the drainage site in your system and in your body. Hello. If you have water in your knees and you're wondering how to get rid of them fast and safely, you've come to the right channel. Hello, I'm Dr. Lin with Empowerment Physical Therapy, and today I want to show you the 3 things that we use in the clinic for our patients who have water in their knees and want to get rid of that water in their knees as soon as possible, but also safely. So what we have on the table are 3 things that we have in the clinic for our patients that have water in their knees. And that's often the result of either they've had a total knee replacement, or if they've had a cyst in the back of their knee, or they've sustained an injury where they had a contusion in their knee, where they bumped into things or fell on their knees, or just kind of or if it's a arthritis, that there's some sort of inflammation in the knee and that there's continuous swelling that happens in the knee. So the first thing first, as you're probably aware of, the bag of ice. That's one of the most common things you're probably aware of and have used from time to time when there's a swelling in your knees. If you don't have ice at home, you can have a bag of beans or a bag of broccolis. These are common household items that you can have to help get water out of your knee. So when is the best time to use ice? A bag of ice or a bag of beans on your knees is to make sure that the moment it swells up, that you apply to it. Given that you probably have other things to do throughout the day, what we recommend to many of our patients who have swelling in their knee is to do it in the middle of the day after they've finished all their activities, or toward the end of the day when they notice that the knee swells up. A couple of things to pay attention to when you're applying ice on your skin or on your knee is number 1 is you don't want to directly apply ice directly on your skin without something covering it. So you can use a towel, you can use a cloth to wrap around the ice and then apply it to your knee. The second thing I want, and I encourage many of our patients to do, is to lie down, have your feet above your heart. So one of the things that a lot of our patients do at home is they would lie on the floor and they would put their feet on the couch or on a chair so that their foot is above. And in that position, gravity now has become your friend, and it's going to help drain that fluid or all the drainage site in your system and in your body. So that's the second thing, so that you can get the best out of that treatment. The third thing is, how long do you keep it on? So I typically like to keep it on for about anywhere from 10 minutes or so, give and take, no more than 15 at a time. So those are the 3 things that I would be aware of when you're applying ice to get the swelling out of your knee. Number 1 is to make sure you have it covering. Number 2 is to lie down and make sure that your foot is elevated above your heart. I would use some sort of Velcro to strap that ice around your knee so it contours around the knee, and that your feet is above your heart, lying down, so that gravity helps drain that fluid out of that knee. And third, to make sure that you stay there for about 10 to 15 is usually the time that frame that I would recommend. Moving along, the second thing that I encourage you to do if you have water in your knee is to have a compression knee sleeve. This is something you put on in the beginning of the day and you wear it throughout the day. There's two types of compression knee sleeves. There's the medical grade, which is anything above 20 mmGH. When you buy, you'll see it 20 to 30 mmHg. That abbreviation stands for mercury. Anything below that is more non-medical grade stocking. So the next question is, which one do you pick? Typically, if there's an excessive amount of swelling around your knee, going with 20 to 30 milligrams per mercury is recommended. And it'll say on the label when you read it. If you were thinking about getting one of these for fatigue or for a long flight, then you can get the non-medical, anything below 20. And you'll typically see it as 15 to 20 milligrams of mercury as the standard for non-graded. So the thing about what I like about these, and that I use it to play basketball for non-medical, is that it gives you the compression that you need to kind of pump the fluid back to your system. What I would use this, if you have swelling and that you have an activity or event throughout the day, is to wear this underneath your pants. And you can wear them out and about throughout the day so that, one, it acts as an assistive device to help to pump the fluid back into your system. So that at the end of the day, if you're on your feet all day long, that fluid just doesn't sit there. Because that's the last thing you want. If you have fluid in and around your knee continuously, your healing is going to be delayed. And that's one of the things that we see continuously. So this is a great addition for someone who's on their feet and they are out and about all day. Moving along is our high-end compression boot stocking. So these compression boots that you see here, they are often used more in athletic recovery, athletes as a form of recovery. So I won't try them on, but I want to kind of roll it out for you to see so that you can see that it kind of goes the entire length of the leg. Kind of goes from your foot to your thigh. It's a nice recovery to have at the end of the day when you've been on your feet all day. And that you can do the same thing as if you're on ice, to lie down with your feet above your heart so that all that swelling can get back toward your heart. The neat thing about these is that these are the ones we have in the clinic. These are wireless. So one, you don't have to kind of mess with the wires. Two, it's easy to put on. And you just kind of strap on and put it on, and you'll feel sort of compressions at a graded from up and down. And that's what we like about those. This is something that you can do about anywhere from 10 to 15 minutes. Go above if you need it, but that's usually the time frame we recommend for a compression boot. Like I said, a lot of athletes, especially runners, use it quite a bit. And any of those, soccer players, any other athletes that compete on a regular basis and are on their feet, they kind of use it. It's a great recovery tool. Even if you don't have swelling in your knees, it's a great way to decrease the soreness that you might have the next day. I personally use it. I've played basketball, and it's helped me to kind of feel less sore the next day. So that's all I have for today in terms of giving you 3 items that you use in the clinic to help patients get water out of their knee. And I'll kind of leave you with a couple of things, is that these things need to be done on a regular basis in couple with strengthening so that you can get that pump. So you can, one, build the strength around your knee so that it could pump that fluid out of your knee on a regular basis using your own body's muscles. Otherwise, farewell. If you have any questions or concerns, feel free to leave a comment about any of the best methods that you use to get water out of your knee, or if there is anything else you'll recommend.